Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's classify the vesiculobullous disorders. Vesiculobullous disorders, and you're going to learn how to classify them. So it is divided into, first is we are going to classify as per the pathology. So as per the pathology, it can be intraepidermal as well as subdermal. Intraepidermal as well as subdermal. So under the intraepidermal, it can include the pemphigus vulgaris, foliaceus as well as the vegetans, and also the pemphigus erythematosus. Next is the subepidermal. So under the subepidermal, it includes the bullous pemphigoid, next the dermatitis herpetiformis as well as erythematous bullous acquita. Then moving ahead, we look at some according to the site. So as per the site, we look at the intraepidermal. So as per the intraepidermal, there is going to be the subcorneal, spinous, suprabasal and the basal. So let's look at what happens in the subcorneal. The subcorneal is nothing but a granular layer. So this includes, there is a pemphigus foliaceus and also the erythematosus. Then this SSSS, that is staphylococcal scarlet skin syndrome, the miliaria crystallina, the bullous impetigo, as well as the friction blister and the subcorneal pustular dermatosis. Then moving on to the spinous layer. The spinous layer, it includes the erythematous dermatitis as well as the HSV or the VZV infection. Then comes the molluscum contagiosum as well as the familial benign pemphigus. Familial benign pemphigus. Next we move on to the suprabasal. So as per the suprabasal, it is the pemphigus vulgaris as well as the diarrheous disease. So there are only two in suprabasal, the pemphigus as well as the diarrheous disease. Next we look at the basal layers. So upon the basal layers, it includes the erythema multiforme as well as the epidermal bullosa simplex. Now let's learn about the subepidermal. So let's learn about the subepidermal or the dermoepidermal classification. So under this, it can be junctional. So junctional is nothing but at the basal lamina. So this includes the junctional epidermobullosa, the bullous pemphigoid as well as the toxic epidermonecrolysis. Then moving on to the dermolytic. The dermolytic means it is below the basal lamina. It is below the basal lamina, and this includes the epidermolysis bullosa acquistica. So it includes the epidermal bullosa acquistica as well as epidermolysis bullosa dystrophicaans. Next, it also includes the deep burns and the porphyria cutaneous tarda. Channel. you.